Well, good afternoon. Welcome. Good afternoon. Welcome to Mindful Monday. We are excited to be here on this beautiful day. At least it's beautiful here in Kansas City. My name is Marilyn Chapel with Exceeds Expectations, and we are honored to have Jess Collins here with Access.KC. Thank you for joining us today, Jess.
Thank you, Marilyn. I appreciate being invited to come talk about our program, Access.KC.
No problem. Thank you for joining us. And, we're going to just jump right on in. Today's segment is called Let's Talk Health Needs in Access KC. And I just want you guys to know all that Access KC has to offer the community and all that they are doing in the community. As we all know, that health, our health is everything. Health is wealth. And so a lot of times there are barriers when it comes to access to health needs. So, Jess, tell me, what made you go into this line of work?
That's a good question. Technically, Marilyn, I've worked in the human services, in social service settings for the past 20 plus years. And so I actually stepped into this role last year on July 18th, 2022, as a program director for, at that time, Kansas City's medicine cabinet. And in the process of this past year and so, we've actually gone through a name change. We're looking at updating our database system in an effort to better provide services, and also additionally to looking at possibly in the near future with a web app or a way for clientele to access our program through our website. So it's working in social services. It for me has been kind of a lifelong process. I enjoy providing resources and helping others improve their quality of life. And medical needs are very important. Our medical emergencies are very important to get addressed. And unfortunately, many individuals who receive services, usually the medical piece is the last on their mind. They're thinking about rent and utility and food pantry, and the medical need just gets put off to the side, to where eventually it's debilitating, or they need much more extensive work done. So,
Yeah.
um,
Thank you for that. Now, you mentioned that you guys used to go by another name that, I had recognized you guys from. And so can you share a little bit more about, what your organization's name used to be, and
yeah.
what you transitioned to? And is there any difference?
So first and foremost, at the very front, there is nothing different except for the name and logos. So you're correct. I mean, it's gonna get a little word jumbled here. So Access.KC is a nonprofit that was formerly known as Baptist Trinity Lutheran Legacy Foundation, or BTLLF, that was established in 2003 following the merger of the former Baptist Medical Center Foundation and the Trinity Lutheran Hospital Foundation. As of May 15th this year, Baptist Trinity Lutheran Legacy Foundation is now known as Access.KC. And in 2005, Baptist Trinity Lutheran Legacy Foundation, the flagship program was launched, known as Kansas City's Medicine Cabinet, which is now known as Access.KC. So ACRUX is formerly Baptist Trinity Lutheran Legacy Foundation, and Access.KC is formerly Kansas City's Medicine Cabinet. We still provide the same services to clientele and households that have gross income up to, but not over, 200% above federal poverty guidelines. The clientele they can seek assistance with things such as durable medical equipment, prescriptions, dental emergencies, optical, hearing aids. We actually do have also do help with like diabetic supplies to some extent, and then recently we reopened up the process in regards to advanced dental. Last year in 2022, we served 2,640. We provided 2,640 services to 2,365
Wow.
unduplicated clients for the total value of over $870,000. Since its inception in 2005, Access.KC has covered the cost of 40,000 plus services to over 30,000 plus clients at a value over $11 million. And what comes down to this program, I mean, I am the person that sits there and reviews the invoices and pays the bills. But our program relies heavily on our partnerships with community social service agencies and also vendors. These social service agencies are the ones, there are 54 locations throughout the Kansas City metro area. Their staff are the ones that will meet the clients and confirm that the client is who they are by reviewing the documentation the client provides, like a photo ID, the social security card or ITIN number or another document, proof of residency for the past 30 days, proof of gross income for the past 30 days, but also like if the client's seeking prescription assistance or durable medical equipment, there needs to be a script specifically. Those staff members meet with clients. If the client qualifies, then they issue the voucher for the specific vendor for the client to go take that voucher to and redeem. The vendor, once they receive that voucher, sends us the invoice and the voucher, and we pay. Now there's a lifetime limit how much we can assist with the client, and there's other restrictions on that process. But the idea of referring somebody to a social service agency is that then the client maybe will have the opportunity to sit down and have a little more wraparound services provided by that staff. I say this because I used to issue vouchers, and conversation, there would be many other reasons why clients would come in and pay a visit, but asking them if there are medical needs, saying, hey, there's this resource out here. Clients, at least if nothing else, had the information to approach later on. We have been asked kind of why did we rebrand and why Access.KC? Basically, Access.KC and Access.KC chose to rebrand and rename because the Kansas City Medicine Cabinet and the Baptist Trinity Lutheran Legacy Foundation brands no longer communicated the right message to our audience. With these new brands and legacy of the Baptist Trinity Lutheran Legacy Foundation and Kansas City Medicine Cabinet in mind, Access.KC and Access.KC continue to help non-denominational audiences while still providing healthcare services to current clients. Access.KC seeks to welcome new audiences that now feels accepted into our new brand. It's just trying to make sure that everybody understands there's not a limit. The only limitation truly for accessing our resources are there funds available for the client to use based on client's past use? And do they provide all the information that's needed for us to be able to issue a voucher?
So Jess, I have a question for you.
Yes.
So you mentioned that you guys provide services for medical needs as well as dental needs. Do you guys also provide services for vision needs?
Yes. Optical? Yes. Yeah. Yes, we do.
I missed that. Yeah.
No, you're fine. You're fine. I probably went through it pretty quick. It's standard stuff that's in my head. Optical, ironically, optical makes up 50 to 60% of the services we provide that we cover.
Awesome. And it covers the whole family, right? Vouchers cover the whole family.
Yes, as long as the family as a household. So the gross income that we look at is the household gross income. If you have, say a two-parent household with two kids, as long as they got documentation of all of those individuals in the household and the gross income for the adults, 18 years and above, the adults is 18 and above, then and they qualify, that household, if say a child in the household needs eyeglasses or needs to get eye exam glasses, they would qualify them, and then go to the vendors that we have, one of the vendors we have, to go get services, and they would go in for the exam, present that voucher, have the exam taken care of, select the glasses, and then about 2 to 3 weeks later, they go back and pick up the glasses to be fitted.
Yeah. So what have you been seeing the most need while you have been there at Access.KC?
Wow. In my short year and a couple months, there is a lot of optical done. We actually, one of our partner agencies actually has done a good job of partnering up with a vendor who's a mobile vendor for optical. And the agency itself actually works with refugees who come and to the United States. And so they basically are working with these refugees who are seeking assistance. And generally speaking, optical is one of the first things they're looking at because of just these other medical needs. Usually they get coverage pretty quick on other forms of medical needs, but optical seems to be the one that needs to be explored by most. Our vouchers are used for those organizations. There is a dental need. Again, we just started opening up our advanced dental. We are currently kind of piloting it with one of our partner vendors, and we're looking at expanding that open, hopefully in the near future with other vendors. The biggest difficulty on that is in regards to oral surgery. How do you cover oral surgery? But if somebody needs partials or full dentures, we have the ability to help them with that process.
Nice.
It's those are probably the big ones I've seen.
Yeah, and I'm glad you explained that because I was just about to ask, what determines the advanced dental, and it sounds like the amount of surgery that you can do.
It's the biggest difference is the biggest difference is, for our emergency dental, somebody has to be presenting with the idea, and this goes for all dental, is somebody needs to be presenting with a level of pain, like sensitivity to coldness or the chipped or cracked tooth, and they need to get that tooth looked at. And that the initial voucher is issued for an emergency visit or emergency dental. It's for exam and consult. There's a whole bunch of back and forth that go between us and the dental provider at that point in time. But the idea is, if somebody needs to have a tooth filling put in or needs to have a tooth pulled, that's usually what they'll cover. If somebody would be a good candidate for the advanced dental, the dental provider themselves will send us a treatment plan recommending further services. So it's not, all our services are based on the idea of a medical necessity. If a client comes in seeking optical services and they want transitional lenses, but they're medically those aren't necessary, we talked to our optical providers about only things that are medical necessity. The same reason why somebody can come in and say they want a wheelchair, but if they don't have like a medical note from a doctor saying they need a wheelchair, I'm not going to provide a wheelchair. And same thing for prescriptions and the hearing aid. Generally speaking, clientele can qualify as long as there's funding. They can qualify for up to 2 hearing aids, a pair of hearing aids. That service is usually once in a lifetime because it eats up so much of the potential of a lifetime max that the client can utilize. But I've heard firsthand from a client who was needing hearing aids, got hearing aids, and was very grateful because at that point in time she had not heard birds sing for a while, and so for her, just hearing the birds sing outside was very reinforcing and very she was very, very appreciative. So yes, that's
so good. And so do you guys also help with prescriptions, or is that something that you refer over?
Prescriptions, we are and that's that. I think I probably need to provide clarification in regards to our vouchers, and then I'll go into the prescription piece. Clients can utilize our voucher one day per year in a 365-day period. So hypothetically, a client comes in today for services, they'll need to wait all the way till September 25th, 2024 before actually being able to seek additional services. The only exception on that is the optical piece, we go 2 years because, and I know this from firsthand experience, clients who sometimes would qualify for our services would also qualify for like Medicaid, Medicare. And I strongly encourage clients to also look at the back of their cards and call their insurance provider to see if there's a way they can get optical like in between those 2 years. If a client needs optical before that 2-year time frame is up and there's a medical necessity, like the doctor says there's glaucoma issues or something, then we can make the exception and they can go get a voucher, but it has to be a full 12 months. Going back to your question about prescription. Yes, we can help with prescriptions. Again, there's the lifetime max the client has. So if you're a brand new client coming at services and you have, say, 10 medications and those medications bump up to or exceed the lifetime max, we'll be able to help you with that one time, but then that's it. The vouchers, the client no longer will qualify. Medication is expensive. We do help with up to 90 days. So the doctor has to write a script for 90 days. It's not the client comes in for the 30 days and then comes back for another 30 days and another 30 days. It's one 90-day time period of prescription-wise. You could have 5, 6, 10, 15 medications, as long as they're not controlled substances and they're not medications that we do not cover. Generally speaking, those are like anti-smoking and other medications. At this point in time, we are reviewing that medication not covered list, but controlled substances is one of those that at this point in time we do not cover. But if the client has a script, 90 days, we encourage them to get 90-day scripts. That way we can cover more.
Yeah, you guys are doing some great work out there. And it sounds like you guys are covering all bases, which is needed, What are some of the partner needs that Access.KC is looking to gain?
Wow. We have we need more vendors in the outliers of the Kansas City metro area. We have a decent amount in the core. We're always looking for dental and optical providers in like the Johnson County, Kansas side, and even Wyandotte side. In Kansas City, Missouri, we need some optical providers out the southwest and northland, southeast, in the northland area. Actually, just if we have vendors that are people that are looking to become partners, we encourage them to reach out or send us an email to the administration at accesskc.org email. Again, optical, dental, pharmacy, we have quite a few, which is nice. DME, durable medical equipment, could always use a few in the outliers. Hearing aid, we have a pretty decent supply, a pretty decent amount, but even then we entertain that. If we have somebody reach out to us and say, hey, I'd like to be a vendor, we kind of look at the area where they're at. Don't necessarily want to flood the area, but we also know that a lot of our clientele have limitations.
With transportation.
Transportation is a small portion of it, but yes, it's there. So, and right now, we have individuals that live in Johnson County that are driving either to KCK or into the KCMO area to get optical services done. And if they're seeking services and they don't have the funds to pay for these on that, then they say, okay, now you got to get in the car. Well, if they don't have a car. So that can be a barrier. I would love to get to a point where we actually had to turn vendors away because it's way too saturated. That it wouldn't be beneficial for either for any of the vendors, but we're not at that point yet. So
This is good information. Good information. And it sounds like you guys offer services on the Missouri and Kansas sides to both Missouri and Kansas residents. Is that right?
Yes, we do. We offer to, in the grand schemes of the greater Kansas City metro area, we offer services on both sides. I, I I kind of giggled when I first started because somebody said, "Hey, is this at that time Kansas City Medicine Cabinet? Is this the Kansas City Medicine Cabinet on the Kansas side?" I'm like, Actually, cover the whole area." Um, it's sometimes what people know. We actually even have we don't have any vendors way up north in like Leavenworth County, but we do have a partner agency up there that's up there. Um, and generally speaking, I mean, people do find ways, clients do find ways to get to where they need to go. They just want to reduce some of that hardship of getting there. And so the more we can have kind of the outliers of the Kansas City metro area vendors, we do have agencies, partner agencies out in those areas. We just don't have the vendors.
Yeah. And I love you guys' website because it is very easy to maneuver through. I like how you guys have put that together because I know last time we talked, Jess, you guys were in the middle of upgrading your website, and so I must say it looks nice and easy to maneuver through.
Well, thank you, and that go give that credit to Beth Radke, who's our executive director of Access.KC. She's been spearheading that, and then also we have a new marketing individual. Her name is Anna Marie, but she was a Vista for us until she got hired recently, and she helped with some of this layout. The On our website, I mean, if people need information, they go to accesskc.org. There's a Get Help tab. It shows how we help. It explains all the documentation that's required, the type of resources, type of vouchers that can be issued. It even has a next step section that says, gather your required documents, find a partner agency, call to schedule an appointment, take the required document to the appointment. And even below that, it says, find an agency, partner agency. It will take that person to where to find help. And that
Nice.
is all the locations that we partner with at this current time. So the beautiful thing about this website is in the near future, we're updating our software data system right now. And in the near future, we're hoping to have, and we will have a client registration portion where the client themselves can register for vouchers. It will take a little bit more. It may take a little more time where the client will have to, it's a self-registration. It's like anything else. If you and I go on some website and we want to get on it, we type our stuff in, except for it's going to ask for proof of the photo ID, the gross income, the address. And so there will be portions where clients can upload that information, and then a staff member on our side, as we will do it as timely as we can, we'll review those documents to make sure that the client is who they are, says who they are, that their information is correctly uploaded in the system, that they're not duplicating themselves in the system. And that they're eligible to receive services at that point in time. There may be some individuals who apply that have already gotten services that don't recall it being Access.KC.
Yeah.
So it's going to be, but the idea is that that individual who's been working, who doesn't, they then need to take off work to go visit a social service agency. Nothing wrong with that, but I heard too many times sitting across from people, they had to take an hour off from work that they weren't getting paid for. So the idea is they're able to fill it out when they're at home. We will respond as soon as we can. As long as they qualify, they'll get a voucher that then they can go redeem at one of our partner vendors. So
Nice.
it's hopefully making that a much more streamlined process for them.
Yes. Well, you guys, this is a lot of good information. So if your health and needs has been a challenge for you, monetary, with cash, with money, then definitely reach out to Access.KC and don't continue to put your health needs on the back burner. this information is just great. When I learned about you guys, I was like, oh yeah, you guys need to be at our vendor events. You guys need to be everywhere where we are. People need to know about you guys, because so oftentimes that's one of the things that we put to the side is anything dealing with our health if we cannot afford it. But what you're telling us today is we no longer need to do that. If that's a need, to reach out to you all and just share ways that you can contact them. You can go online, learn more about them and see what needs are covered. And then here's administrative at accesskc.org, and the contact number up there too. So definitely reach out. Let today be the unction for you to take the next step, right? So Jess, can you tell us, is there anything else that you would like to share with us that we need to know about Access KC? And then end it with a empowering quote, word, whatever you want to give us for this week.
Okay. I will do what I can on that one. But in regards to anything else additional, people want to reach out and they want to know more information, please do. I schedule Zooms. I do in person. It kind of depends on when time is available. We are looking for partners. People can definitely request and see about maybe being partner vendors. We are currently going through our updated database system, which is taking a little bit. Okay. And that means that it's going to be good. When it launches, that's going to be good, which means we'll have the upgrade for the client self-registration portion. We have new marketing material that if somebody wants some marketing material like flyers or business cards, we are more than willing to have those sent out. We have two new staff members that started since February of this year. Veronica Hernandez, which is a client support specialist. She reaches out to clients to make sure they redeem their vouchers. We have Carrie Preston, who is our partner coordinator. She is a person that does a lot of visiting to our potential vendors, current vendors, and partners. And then we also have Stacia Hardaway, who is our program specialist. Stacia is the end all be all in regards to knowing about our current database system and how things get done. We do plan on keeping our website up to date. We do plan on that client self-registration going soon. There's a lot of change, and also we ask that you provides a little bit of forgiveness in regards to if we're not quite up to speed yet. We are getting there, and I'm very, very, very hopeful and thoughtful and believe that within a year's time, you're going to see this thing working like a well-oiled machine, and we're going to be able to take care of a lot of different needs. Finishing thoughts. Wow. I mean, this comes from me sitting across the table from people and talking to them, and talking not to them, but with them, and listening. I'm doing a lot of listening. And the one thing I wish everybody would recognize is, and it can be cliche, everybody struggles. Everybody's got a burden they're carrying. Everybody's weighted down by something. And honestly, ultimately, everybody just wants to be accepted for who they are, where they're at, and supported. And I think if we did that as a whole, I think we'd be in a lot better place as a world. So if it's a matter between 5 seconds, well, it's amazing what 5 seconds can do with somebody. So if you got the time, sit and listen to somebody. And not to listen to judge or to have preconceived ideas of what you're going to feedback, but sit to listen to understand. And I greatly appreciate this opportunity to come on and provide feedback about Access.KC. It's been quite a growth year, and it's been challenging, and I believe it's going to be very rewarding as we go forward. So thank you so much.
Thank you, Jess. And there you guys have it. Please share this with anybody that you know, anybody that you think that would benefit from this information. Please share it and help people get connected to options to no longer put their health on the back burner. So there you have it. Have an amazing week. And thanks again, Jess, for coming on and joining us on today.
Definitely. Thank you. Thank you, Marilyn.
You're welcome. You guys have an awesome, amazing week. Bye.